This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
After engaging in various summer activities these past few weeks, how is your skin looking right now? Do you notice any uneven color or pigmentation on it? Do you see any lines or wrinkles that weren't there before? I'm Dr. Freddy Gomez, and let's talk about post-summer skincare only here on Medtalk. With the summer season about to wind down, it's time to give your skin some much-needed attention after it has been worn out by day-to-day activities under the harsh sun. Exposure to the UV rays of the sun may cause one's skin to develop a whole array of sun damage, ranging from sunburn, premature wrinkles, and at worst, skin cancer. With solutions ranging from chemical peels, lasers, Botox, and fillers, how would you know which one is right for you? As we say goodbye to summer, rejuvenating and maintaining one's skin is now a priority. How can we achieve that youthful, revitalized skin? And what are the latest treatment options available for your skin type? We have on the show Dr. Stephen Lacson, and he's a dermatologic surgeon. Welcome to the show, Dr. Lacson.
Hi.
Hi, welcome to the show.
Yeah.
Now, Dr. Lacson, what are the different types of pigmentation?
The most common form of pigmentation you usually see are the freckles, the sunspots, what we also call solar lentigines, melasma. You see people with the patches on the cheeks and sometimes in the nose or in the forehead. You see that mostly in women, and you can also have some post-inflammatory hyperpigmentation.
Okay, now what are the factors that contribute to these types of pigmentations?
Sun exposure, number one. So it stimulates the melanocytes to form melanin. So you see a lot of the freckles coming out during summer, the sunspots. And problems like melasma, there are more factors to it. You can have sun exposure, hormones that can also make it more seen.
Now, Dr. Lacson, you mentioned that the sun is one of the main factors for causing these pigmentations. If someone wears sunscreen, are they completely protected from these harmful effects of the sun?
Not completely, but at least you can limit it. No, you can't protect yourself from the sun 24/7, so you're still going to be exposed. And it depends how much we protect from your clothing, from your hats. And sunscreen, if you wear it properly, the correct intervals, so you can at least minimize the sun damage later on.
Now, really quickly, doctor, since you mentioned sunscreen, what's a good interval of putting on sunscreen? And can I just put one layer and have it on the whole day?
The recommended is every 2 hours. Of course, it's hard to follow sometimes. My patients, they go to work. So at least 2 times a day for daily use, because you can get sun damage also from UV rays indoors aside from outdoors. So when you go to the beach, try at least 2 to 3 hours at least intervals.
Okay. Now, if someone has these pigmentations on their skin, what are some of the professional treatments that you would recommend?
Well, if you have pigmentation, you can go from chemical peeling, where you want to renew your skin, take out the dead layers, and you have pigment lasers, which targets a specific pigment on the level where it is by using different wavelengths. You have resurfacing procedures, which will also help penetrate your topical products to enter the skin.
Now, with all these treatments that you mentioned, there was one that you mentioned that involved lasers. Are there any side effects to any of these treatments?
Oh yeah, especially if you have dark skin, or if you just had a tan and you go for a laser, you have a risk of getting burns, post-inflammatory hyperpigmentation, or even hypopigmentation. So you have to be careful who you go to, that they are certified doctors.
Okay. Now, once someone undergoes this type of treatment for pigmentation, are the results permanent, or do they have to come back for several treatments?
It may take several treatments for it to lighten, depending on the type of pigment. And if you go under the sun again without protection, it will come back.
Okay. Now, are there any products, doctor, that you would recommend to not necessarily lighten the skin tone, but make it sort of even it out?
Even it out. Well, it's good to use something with retinol or retinoids like tretinoin, even alpha hydroxy acids, just to exfoliate the skin, to even out the skin. Lightening products, hydroquinone or non-hydroquinone products like arbutin, licorice, and all that. As you mentioned earlier, people who come from this beach, they sometimes come back blotchy, with uneven skin tone. So you want to renew the skin and take out the upper layer.
Okay,
Yeah.
very well said, doctor. Now, for some of us, staying under the sun is the only way to get that nice golden tan. But is getting a tan under the sun generally a safe thing to do? Stay tuned to Medtalk to find out. Only on CNN Philippines.
When something feels right, I know that nothing can go wrong. That's how I know I made the right choice. Petron XCS, formulated with Tri-Action Advantage to give better engine protection and complete combustion for optimum performance. I know my car performs right. When it comes to fuel, I choose what I know is right and best for me. I choose Petron XCS.
Top story today. Anthony Davis and the Pelicans face the Timberwolves in NBA action today.
The Astros will face Malaysia in a friendly.
How legit are his chances of winning that award at the end of the season?
Kai Soto, Rookie of the Year.
The Lady Archers reveal secrets behind their winning chemistry.
My name is Andre Felix.
I'm Miko Halib. This is Sports Day.
Welcome back to the service road. Back to the service road. Let's take a look at the leading e-bike center in Metro Manila. Have I told you lately that I love you? Tando show, we're going to do a little dance. I'm going to dance for you. I do it so badly.
Stories, legends, general knowledge, and the history of mankind.
Beyond the headlines are deeper stories of humanity that touch each and every one of us. Here on Profiles, we bring you the slices of life, truth, and personal meaning beyond the headlines through stories of those shaping our world. Join me, Mitzi Borromeo, as I uncover their profile.
How frustrated are you with our transportation system?
Oh, very, very. Traffic is so bad now. Now people are starting to listen. Come to my man cave.
Wow!
This is easier to explain, no? The benefits of having a railway system.
Let's rate the presidents. Ferdinand Marcos. Korea Kid. FVR. Sino ba sumunod kay FVR?
President.
Just kidding.
A setback over Britain's plan to exit the European. Donald Trump makes his first address to Congress. Terrorist group ISIS is falling apart. You're watching Global Newsroom. I'm Pion Together.
The compact SUV segment is among the fastest growing segments in the entire automotive industry. So it comes as no surprise that Chevrolet pretty much threw everything they had at developing Chevrolet Traction. The ride and space of the car for the price point is pretty good. And right now I'm just going to enjoy the rest of these winding roads because I'm having a little fun in this car, I tell you. The steering is nice and tight, it's light enough, but it seems to be able to handle these curves quite nicely.
So you wanted to fulfill your mom's dream, but not in the way she envisioned it.
That's right. She wanted me to become a doctor.
But then you said you still wanted to fulfill her vision.
Her vision of making the Philippines the most beautiful country in the world, one person at a time.
What is the key to making sure it runs well, from your perspective?
The key is really investing in good people. A players hire A+ players. I hired people who are better than me.
Crystal Bello of Intelligent Skincare, next on The Board.
Nina Daza Puyat. Welcome to Leading Women.
Of course, your mom,
Nora Daza.
Yes.
Filipino food lover.
Correct. And advocate. She was really more about learning how to cook and sharing what she knew with others. That's what I'm also doing now.
You are also the editor-in-chief of Appetite Magazine.
Share recipes with other people. There's just so much more to learn.
Can there be meaningful peace talks while fighting is going on? The NDRRMC is on red alert. There are 3 soldiers held hostage. North Korea on Sunday test fired a missile. I'm Mai Rodriguez. Keep it here on CNN Philippines.
We're at the night market in Davao City where the deadly blast happened. 14 people died, dozens still in recovery.
Did you know that melanin is what gives skin its color? Melanin also protects your skin from the sun, but it doesn't completely protect you, and the sun still damages people with darker skin. Also, the darker your skin, the more difficult it is to tell when you are burning. People also may think that they are better protected if they have darker skin, and they may take less precautions regarding sun exposure and end up staying in the sun longer, and eventually leading to more skin damage. Tanning, or the process of exposing your skin to sunlight, is an immediate solution if someone desires to get a darker skin tone. But how safe is this practice? Still with us is Dr. Stephen Lacson, and now joining us is Dr. Paolo Santos from HOO Dermatology. Welcome to the show, Dr. Santos.
Hi, thanks for having me.
All right. Now, later on we'll talk about what it is we can expect from an aesthetic center. But first, with Dr. Lacson, what basically is sun damage?
Well, sun damage occurs, of course, it's called, when you're under the sun. That's why it's also called photo damage. And you can get burns from UVB radiation, and you can also get premature aging from UVA radiation because it penetrates deeper into the skin. And this can appear later on, so you can have dry skin, thickening of the skin, you can have pigmentation and wrinkling.
How can someone know that they already have damaged skin from the sun?
You look at your sun-exposed areas, your face, the chest, forearms, legs, compare it to the other parts of your skin, and if you start seeing these changes, like what I said, dryness, wrinkling, pigmentation, then most likely those are from photo damage.
Now, Dr. Santos, we were talking about the different treatment procedures when someone has sun-damaged skin. Mm-hmm. If I go to an aesthetic center, what can I expect?
First of all, in going to an aesthetic center, especially the ones that have board-certified doctors, the first thing that you have to expect is the doctor cannot just think that you're coming precisely just for your skin. So a full medical history has to be taken the first time around, after which a beauty plan will be made for you.
Okay. Now, Dr. Lacson, if someone has pigmentation, sun damaged skin, can this really be repaired?
Yeah, you can reverse the signs of photoaging. You know? Maybe not completely, but at least you can do certain procedures. You can do chemical peels, laser resurfacing, pigment lasers, to lessen the wrinkles, lessen the texture, improve the texture of the skin, improve the dryness. So you try to reverse it.
Okay. Now, who are the best candidates for this type of skin rejuvenation?
Okay, well, skin rejuvenation, they say 35 years above, that's when they start doing it. But nowadays, I don't really follow it by the age, because sometimes some young people look older, some older people look young because they take care of it. So you can start even at younger ages. It's a way of preventing the aging process also.
What exactly happens when you sort of rejuvenate the skin?
Well, rejuvenation is a broad term for us because it's like a way to make your skin look young. So it can mean improving the texture, improving the pores, the lines, lessening the pigment, lessening anything that makes you look older. So we can do it with lasers, different machines, radio frequency, ultrasound, injectables, and there are many ways to do it.
Is there any difference between that and sort of anti-aging treatments, which we hear a lot nowadays?
Well, I think lasers are part of anti-aging treatments as well. There are just many more kinds of treatments because nowadays we treat depending on what we see, whether we give oral medications, topical creams, injectables. So it really depends. You can't really specify which one.
Now, Dr. Santos, can someone go to an aesthetic center and have some cosmetic services done that doesn't involve surgery?
Actually, that's a very good question because it's a very popular topic nowadays. There are two very good procedures that are going around today. One is the thermage and one is the Ultherapy. Okay, and both of these are non-invasive lifts. What that does is it basically penetrates several layers of the skin by different mechanisms, resulting in tightening and lifting of the face.
When someone goes to the aesthetic center, how does someone know whether they should use the thermage or the Ultherapy? Are they more or less the same thing, or are they distinct procedures?
They are distinct procedures. Okay, one uses radio frequency energy, and the other one uses micro-focused ultrasound. They both result in similar effects. One is more for tightening and smoothing of the surface of the skin, and the other one, which is the Ultherapy, is more for lifting and tightening.
Okay. Now, Dr. Lacson, with the procedures that Dr. Santos mentioned, after undergoing Ulthera or thermage, how long can the patient expect to sort of benefit from the effects?
Because with these procedures, you try to stimulate collagen formation. That's the main goal. And it takes around 3 to 4 months to see the effects of the tightening and the lifting. So they just have to be patient.
Okay. Very well. Thank you, doctor. If you feel your skin may have been damaged due to repeated sun exposure and you want to bring back its original glow, the next discussion is for you. We discuss the treatment options for sun-damaged skin and wrinkles. This is Medtalk on CNN Philippines.
Get your morning sports fix with me, Andre Felix, weekdays at 11 a.m.
And me, Nico Halili, weeknights 7 p.m. and 10 p.m. on Sports Desk. Only here on CNN Philippines.
Sa newsroom ngayon, makikita nyo pa rin yung nakagisdan nyo na kalidad ng pagbabalita sa CNN Philippines. Ito ay para sa inyong mga Pilipino. Mula Lunes hanggang Biyernes, alas 10 ng umaga, ang newsroom ngayon ay hindi lang tungkol sa paghahatid namin ng balita, kundi kasali rin kayo sa aming talakayan. Kung ano yung mga komentaryo nyo, reaksyon nyo sa iba't ibang issue na kayo rin ang magsasabi sa amin kung makabuluhan ba sa inyo o napapanahon at kung gusto nyong talakayin pa ng mas malalim.
The compact SUV segment is among the fastest growing segments in the entire automotive industry. So it comes as no surprise that Chevrolet pretty much threw everything they had at developing Chevrolet Traction. The ride and space of the car for the price point is pretty good. And right now I'm just going to enjoy the rest of these winding roads because I'm having a little fun in this car, I tell you. The steering is nice and tight, it's light enough, but it seems to be able to handle these curves quite nicely.
The Muntinlupa Regional Trial Court issue a warrant for the arrest of Senator Laila de Lima. What is the basis for Arbitrario's arrest? Why did they arrest him? There is a text message, reportedly a threat from the Apusea. How credible is it? Our correspondents are at the heart of the story from all angles. Mayor Duterte, thank you very much for joining us. This is Newsnight. I'm Pia Ontiveros.
Apart from being the shortest route from Manila to the Pacific Ocean, Real Quezon has a lot to offer besides the mellow surf. The beauty of travel really comes from going off the beaten path and immersing, doing as the locals do.
Wow! Ang ganda!
How frustrated are you with our transportation system?
Oh, very, very. Traffic is so bad now. Now people are starting to listen. Come to my man cave.
Wow!
This is easier to explain, no? The benefits of having a railway system.
Let's rate the presidents. Ferdinand Marcos. Oriakin. FVR. Sino ba sumunod kay Sino ba sumunod kay FVR?
President.
Just kidding.
So, Christine, is it your first time to do a morning show,
Yes, this is my first time waking up early again.
To work with you guys, childhood dream. Achievement unlocked. Yeah.
The best part about being part of a morning show is we all have different things that we're interested in.
It's nice to start the day early, and there's also a great morning audience. And they love and exactly no traffic.
I'm Jessica Zafra. I'm a writer.
I'm Pepe Jokno. I'm a filmmaker.
I like to travel. I like to travel alone.
I love to travel. Whenever I travel, I discover something about myself. Jessica's the worst. Jessica's the worst travel buddy. We're opposites when it comes to travel.
I like to think that Pepe and I complement each other. I like to read up on a place before I get there. And he likes to discover it as he goes along.
Trippies is a different kind of travel.
We like to immerse ourselves in the culture and
go beyond the guidebook.
Instead of going there and just being tourists. Trippies is spontaneous, immersive, kind of nerdy.
In Trippies, the journey is the destination.
If you really, really want to make a difference, then you act on it. The first step for me was like, okay, I'm gonna use a metal straw. When people around you are telling you you're doing something right at such a young age, it inspires you to make sure that the rest of your life is actually geared on that.
Buhay ko na po yung pagtuturo. Buhay ko na po yung pagtuturo sa mga bata. Bilang isang kabataang Pilipino, ginagawa ko po to kasi gusto ko makita yung pagbabago.
The Chinese Coast Guard made its message clear. The Philippines is still not welcome.
Here are some myths and facts about your skin and how to keep it healthy. First, well, it is true that a small amount of sun is good for acne and your skin in general. It must be remembered that any benefits are very temporary. Continual sunbathing will lead to dry skin and cause the sebaceous glands to produce an excess of oil. In addition to this, when you have been exposed to the sun, more dead cells will need to be removed. The combination of dead cells and extra sebum oil will lead to blocked pores, which will almost certainly lead to more acne. Next, in actuality, a tan is a sign of skin damage. Skin tanning is a sign your skin cells and the structures of your skin have been damaged, even if redness or peeling was never present. You're gaining skin color at the expense of your health. And last, while melanin in the skin does help prevent sun damage, it doesn't prevent all damage. It doesn't matter if you burn or not, sun exposure still damages your skin, leading to aging, wrinkles, sunspots, and more serious consequences. You should still be cautious when in the sun regardless of whether or not you think you might burn. Welcome back. We're still talking about post-summer skincare, and this time we'll discuss the ways on how to rejuvenate your skin. Still with us are Dr. Stephen Lacson and Dr. Paolo Santos. Now, Dr. Lacson, how can someone avoid fine lines and wrinkles on their skin?
You can slow it down. One, you can avoid sun exposure, but I know you can't avoid it totally. At least lessen your sun exposure, wear sunscreen. Two, avoid smoking. lessen your stress, sleep early, and of course you can also undergo treatments to help maintain your skin and try to slow down the aging process. That's why some people come while they're young, so at least maintain and slow down the aging.
Now, Dr. Lacson, are there topicals that someone can put that can effectively sort of lessen these fine lines or wrinkles?
Yeah, we normally give, for mild cases, we give alpha-hydroxy acids. These are the fruit acids like glycolic, mandelic, malic acids. We can give salicylic acid. But I like giving tretinoin, which is very good for smoothing the skin, and it's also good for collagen remodeling. So, and sunscreen, of course, to prevent the sun damage.
Okay. Now, Dr. Santos, is it common practice for an aesthetic center to offer Botox and fillers?
In this day and age, yes, actually, it's very common. It's a trend that's actually picking up very fast nowadays. Like almost everyone is starting to have Botox and fillers done on them. I don't know if the trend is going to be increasing, no, but it definitely is a big thing right now.
Right. Now, Dr. Lacson, what are some of the benefits of Botox and fillers?
As you know, Botox is the #1 cosmetic procedure in the world, not only here. No? So, good thing about them, you get the results fast, and patients are happy right away. Like Botox, sometimes if you notice, when you have wrinkles, we have static and dynamic wrinkles. I don't know if you know that. When you're not doing any expressions and you see lines on your face, that's what you call static wrinkles. And if you're doing expressions, you're smiling and everything, it gets deeper. Those are dynamic wrinkles, and that's because of the muscles of your face. And Botox is what you use to weaken those muscles to lessen those wrinkles. Now fillers, there are a lot of uses for fillers. One, for volumizing. You lose fat as you age, sag, gravity, so you need to volumize. Two, to contour the face. Some people with round faces want to make their faces more oblong, more feminine. Three, fillers can be used to enhance certain features of the face, like your lips, your nose. And lastly, they can also be used to hydrate your skin. For those with really dry skin, since we normally use hyaluronic acid, we inject it superficially on the skin, and it attracts water and it hydrates and plumps your skin. So there are a lot of benefits for Botox and fillers.
Okay. Now, can someone administer Botox and fillers at the same time, or there has to be a gap between the two?
You can do it at the same time, as long as it's not on the same spot, right on the same spot. So you can do it in different areas of the face, and just make sure you go to a certified doctor who can do it, because you can get side effects easily if you don't know how to do it. So make sure you don't play around with your skin, with your face or your skin, and go to a certified dermatologist.
And I think we can't stress that enough, that have these procedures, Botox and fillers, done by a certified doctor. Yes. Dr. Santos, do you have any final words or message for our audience out there with regards to visiting an aesthetic center?
Choosing an aesthetic center is really a matter of preference, okay? But my suggestion would be, before you do go and go to any aesthetic center, do the research first, okay? So make sure that you do get a center that has all board-certified dermatologists. And secondly, before you have any procedure done, do the research on that as well.
There's that saying that goes, an ounce of prevention is worth a pound of cure, and that also goes for the skin. So take care of your skin, keep your skin healthy, protect it, maintain it, because sometimes you don't see the effects now, but you may see the effects of the damage later on. That's it.
Very well said. And with that, we'd like to thank Dr. Stephen Lacson and Dr. Paolo Santos for joining us today on Medtalk. And we'll see you again next week for more health discussions and weekly consultations here on CNN Philippines. I'm Dr. Freddy Gomez. Thank you for watching.